Hi, I'm Dr. Matt Sheehan from Medford Family Chiropractic Center in Medford, Oregon, and I'm here today with my friend Julie, and we're here to demonstrate several sacroiliac stretches, and I use these frequently in my practice, and if you are coming to this video today from my website and you're a patient of mine, you're probably looking this up because you have some questions. And the devil is always in the details with these stretches, so I'm glad you're taking the time to check these out and make sure you're doing them correctly. So we're going to jump right in and start with this one right here at the bottom, which is a little bit tricky. It's just to help mobilize the sacroiliac joints in a certain way, and I'm not going to bother getting into the details about what the actual fixation involves in the pelvis, but I'm going to show you how to stretch this accordingly. All right, so my friend Julie here is going to stand up for a sec. Julie has not done these yet, so this is good. You'll hear how I describe how to do this to a person who's totally new to it. So Julie, what we're going to do is we're going to have you just do what I do, and that's the easiest way to do it on that side. So just watch first. So I'm just going to bring one leg back like that, and the other leg I'm going to bring forward. I'm going to put my chest down on towards the table like this. So see, I'm just kind of half on the table and half off. At home, you can do this on the bed, you can do this on the couch, all right? And you're just laying yourself on there like that, on your forearms, and this leg here on the outside is going to be just comfortably up as far as you comfortably can. And then you're going to rest yourself down here, and the idea is to hold yourself down on the table, hold your pelvis down on the table on this right side, and then to do a push-up like this. So we'll get Julie doing it, and then I'll point a few things out. So there we go, and just comfortably let yourself lie down like that. So again, we see the leg on the outside is flexed up comfortably like that. This leg is stretched out. And so I'm going to have Julie just concentrate on keeping this part of her pelvis in contact with the bed or the couch at home. And now what she's going to do is she's going to use her arms to push her torso up like she's doing a push-up while she keeps the pelvis down. So basically, the torque that we're trying to get, the stretch in terms of the sacroiliac joint, is on this part that's on the table. So as she's bringing her torso up and her lumbar spine, she's also bringing the sacrum back with it, and it's just imparting a stretch on this left sacroiliac joint in a certain way that's helpful, because that's where theoretically she would have been stuck. That's why I would have given it to her. Okay, so and you're just going to hold it there for 30 seconds to a minute, and as Julie's probably figuring out, wow, it's also a good arm exercise, good for the triceps, just as a push-up is. So if you can hold it there for 60 seconds, and as you feel the stretch starting to ease up, you push yourself further up, so you maintain the stretch during that minute. Okay, there's the first one. Thanks, Julie. Okay, so for the second sacroiliac stretch, we're going to be focusing on this upper one right here. This one's a little less complicated. And we're going to have Julie lie flat on her back, and we'll demonstrate that one. So if you can, don't worry about your shoes, you can just lie flat on your back. And I'm going to put this pillow under your head. There we go, good. And so what we're going to do, Julie, is we're going to have you pull this right knee towards your chest for me. And so with this one, as in all stretches I teach, I just want people to bring the limb towards, up as far as they can. So bring it this way until you start to feel a stretch. It's all about where you start to feel a stretch, not pushing through that point to the point where you feel an extreme stretch or to the point where you feel pain, thinking that you're going to heal quicker if you push through the pain and ignore it. All you're going to do is hurt yourself. And I've seen that over the course of 30 years, and it's true. So you bring it up slowly and gently, just really focusing on where you start to feel a stretch. That's the point where you're going to start the exercise. And from here, what you're going to do is to speed up the relaxation of the muscles. At this point, you're going to resist with your hands, and isometrically you're going to push the knee, or the knee itself under its own power is going to push this way against the resisting hands. And as the knee pushes this way, trying to straighten the leg out, the hands resist, but the knee, this part's very important, the knee and the leg are only pushing against the hands hard enough for you to feel the leg muscles somewhere just starting to engage or just starting to work. And typically where you're going to feel it, you'll feel it in the hamstring, you'll feel it in the buttock, because those are most of the muscles that are pushing this way. And you might also feel it in the quadricep a little bit, the front of the thigh. But as soon as you really got to focus on this, because as soon as you feel those muscles starting to engage, that's how hard you push. More, in this case, is not better at all. It's subtle, but very powerful. And you'll see this theme, this technique, used through a lot of the stretches that I use, where you isometrically gently push against it for, it's called the hold relax, called a lot of other things, but hold relax is one easy way to remember it. And you push for a slow count of 6. So you're counting, as soon as you engage, you start counting 1, 1,000, 2, 1,000, 3, 4, 5, 6. When you get to 6, you don't move the limb, you keep it right where it is, but you quit pushing. And then you take a deep breath way down in your belly, not up in your chest, but way down in your belly, and then you breathe out. And that just helps you to totally relax and let go of everything. And now what you're going to do is you're going to see if you can pull the knee any closer towards the chest. There we go. And often, just like Julie just did right there, you get, at least an inch, often 3, 4, 5, 6 inches more as the muscles relax. And so you'll once again bring it to the edge of where you start to feel the stretch again, and then you stop. And the knee will once again push against the hands lightly enough to just start to feel the muscles engaging. Then you count slowly to 6 one more time, and then you relax, and then you take a deep breath in and out again. And so you can do that. If you're incrementally still feeling this leg coming towards this same side shoulder, then you can do it 3, 4, 5 times. Okay, so this helps not only release the buttock muscles and the hamstring muscles, some of the low back muscles sometimes, but it also helps to mobilize the sacroiliac joint in a certain way that's fixated. So it's very helpful. Thank you.